Welcome to Medfem Fertility Clinic's Masterclass vlog. Today we're going to look at the absolute indications for in vitro fertilization and ICSI, also known as intracytoplasmic sperm injection. Firstly, what do we mean by absolute indications? Effectively, this means that in order to achieve a pregnancy in a couple, one has to use IVF as a solution to the problem. These indications include blocked fallopian tubes. Often this would have been blocked either by infection or by previous sterilization. Male factor infertility that requires injection of sperm into the egg to achieve a pregnancy. If a couple are making use of donor eggs or surrogacy, the IVF process has to take place. If there is a need for PGS, which is pre-genetic screening, or pre-genetic diagnosis in patients with genetic diseases, then IVF has to take place. And lastly, if there's going to be preservation of oocytes or eggs and embryo preservation. And this is often in patients who have opted for delayed pregnancy, or if they are about to undergo cancer therapy. So what is ICSI? One can see from the picture that ICSI is taking a sperm, putting it into a very fine glass pipette. The sperm is then injected via the glass pipette into the cytoplasm, which is the outside layer of a cell. What this effectively does is allows that single sperm to fertilize an egg. So when is this indicated? Firstly, in patients who are found to have a poor HbA test. This test is what we term a sperm binding test. It gives us an indication whether the sperm has the ability to bind to the egg. If it has a low chance of binding to the egg, then the sperm needs to be injected. If there was no fertilization in a previous IVF cycle, and then the treatment of severe male factor infertility. And this includes oligospermia, which is a low sperm count, asthenospermia, which is low movement or motility of the sperm, and or teratozoospermia, which is a very low normal count of sperm. Lastly, the other indication for injection of sperm into the egg is immature sperm, or what is known as obstructive azoospermia, which means that when a sperm count is done on the male, no sperm is found, and it's either due to an obstruction where the sperm can't find its way from the storage duct into the ejaculation, or in fact where the sperm is not being developed properly by the testes. In order to retrieve the sperm, one uses either a percutaneous sperm aspiration from the collecting ducts known as the epididymis, or from the testis itself known as a testicular sperm aspiration. And then lastly, one may have to do testicular biopsies in order to find some viable sperm. In conclusion, the purpose of today's vlog was to highlight the times that you, as a patient or as a fertility couple, need to look at IVF as absolute indications to achieve a pregnancy. Thanking you, Dr. Antonio Rodriguez.